Good morning. Thank you for joining us. Here to give you an update about our situation and some of the work that happened over the weekend with the Incident Command and the Emergency Operations Center. First, a update on our case count. We currently have, we're still standing at 4 confirmed cases, 1 death, 173 Lane County residents have been tested, 169 of which are negative. I also wanted to give you an update on our last case, our 4th case. We had not a lot of information available on Saturday, and so I wanted to provide that to the public for better understanding, while also maintaining the needs for privacy and respect for the family as they're going through a tough time right now. This individual is a woman in her 70s. As we mentioned in the press release, she has a history of domestic travel. That travel happened between March 9th and March 16th and included a domestic hotspot. Right now we're being told that that is somewhere in the state of Louisiana, where they have a large number of cases. Symptoms began on March 14th. With extreme and unexplained fatigue. And so really that piece about unexplained fatigue is what is key in this. Obviously there's a lot of people who are feeling emotional duress right now, allergies and other explainable fatigue, so this was unexplainable, and that really is the hallmark of what we're looking for in those case investigations. In addition to that, she did have a light cough and a fever. The symptoms reached their maximum on 3/17, so March 17th. She was hospitalized on the 19th, where testing occurred, and was intubated in the ICU. We would just really underscore the need for understanding and caring at this time. Obviously, this is an individual who is not medically stable, and so the family is obviously going through issues on trying to cope with that, and anything that we can do as a community to reach out with our love and compassion by not really prying into their privacy is really appreciated. At this time, we have not identified any public exposures. It's really important for folks to know, and given the fact that this individual was sick upon returning to Lane County, did maintain isolation the entire time in Lane County. So it's all good news. Also wanted to jump subjects now into our small business loan program that, as you know, we announced that program was available on Sunday at 12:30. Right when the program became live, we almost immediately exceeded the amount of resources available. 200 applications were received. A multitude of different industries represented, from food and beverage to various other industries who are feeling the impacts here in Lane County. About 350,000 of those funds that came in, requests for funds, came from Eugene, 150,000 in Springfield, and 120,000 in our rural Lane County areas. So if you do the math on that, that exceeds the 400,000. We do expect federal resources to become available, but in the meantime, until those do become available, our team here in our business continuity is looking into private funding and other revenue streams to try to help our local small businesses weather the impact of COVID-19. We have received communication from our partners at the coast. You probably saw the media over the weekend, a large number of people going to the coast. Completely understandable in terms of why maybe the folks made that choice with the beautiful outdoor weather that we had. However, we need to keep in mind that those communities have limited supply chains. Being on the coast, they're not on the I-5 corridor, so they get fewer supply runs to their grocery stores, to their pharmacies. So we really need to be respectful and stay away from those communities right now. I know that there's been some action taken on the North Coast to try to enact that. We're going to go ahead and, in lieu of the governor's orders coming down shortly, just really encourage folks not to make that trip to the coast. Also being aware that they have a high number of people that are in that at-risk group out there. So really being respectful, not using their resources, and giving them the space they need. Going outside is still absolutely acceptable and okay, so long as you keep that 6 feet between you and other people around you, obviously excluding your family members who you went to the outdoor space with. I think the key here really is not traveling to go outdoors. trying to utilize the outdoor spaces that are within the immediate vicinity of your residence is going to be key. And really going back to the message that I think that is going to be drilled down between now and when the governor's orders come out, but then even going forward, stay at home. Please stay at home. That's going to be key to flattening the curve. And it has a lot to do with folks not catching the virus, not spreading the virus, but also just being very aware of the fact that as we are starting to see limited resources in the community, things across the board, that the less we travel, the less we utilize resources, the better off we'll be. Also, just really being aware of the fact that asymptomatic transmission has been noted to occur. And so if you are feeling okay and then going about your daily life, you do put others at risk of that asymptomatic transmission, which is really one of the main reasons why we should all do our part, do the right thing, and stay at home. I would like to send a little message of encouragement that we have checked on our supply chains, specifically on food and medical supplies, and right now we are in good standing, especially with food. Folks might not feel that when they go to the grocery stores, when they see those shelves empty. However, that's just because of the pace of demand and not because of the supply chain itself. So please be patient, understand that supply chains are stable, and that all you would need to do is return to the store at a time when they have the ability to restock. Also being very aware and courteous of our much needed grocery stores and the staff that are currently working at those grocery stores. They're doing the best they can, and they also have folks that work for them that are in at-risk categories who need to stay home. So please be kind and understanding to those folks who are just trying to do the best they can to keep us all healthy and with the supplies that they need. We have not received specific direction from the governor at this time. We're looking at that today, but looking forward to that in terms of planning. Folks want to know, what can I do right now? And that's a valid question. We have just a couple resources in the next few hours until we anticipate that message from the governor. Points for consideration. So looking at your supplies that you have in your home and making a budget for your supplies so you understand how much you should be using per day and then when you could potentially run out and need to go and restock. We are encouraging people not to hoard or stock up for 3, 4, 5 weeks at a time, but really just what you need right now, and then try to bundle those trips to the grocery store as appropriate so you're not making multiple trips and multiple potential exposures. I would also like to hit on our call center. Our call center has been an invaluable resource with having those one-on-one conversations with the public that both helps get the information out to our public, but also helps us keep informed as to what we should be talking about and the information that needs to be available in our community. To date, that call center has received around 4,000 calls from our community, a tremendous number, and we're looking to expand our call center to be able to take more calls. So one of the options in that expansion is moving to a more virtual call center to protect our call center staff. We're also working very hard at our PPE donations. As we mentioned last week, we do have a donation center available. That is at 3050 North Delta Highway up there at the Public Works Warehouse. And they're taking donations Monday through Friday from 2 p.m. to 4 p.m. We're expecting with the governor's orders there will be potentially more PPE, specifically nitrate gloves available. And so if that is the case for your business, if you're a tattoo parlor or another industry that uses some of those supplies but don't need them right now, we encourage you to make those donations up to the Public Works Warehouse. A little message: we've received a lot of people who are writing in saying, I'm willing to sew masks and try to help out in any way we can. We are very encouraged by the level of commitment our community members have towards the effort and their ability to help. We would encourage you right now to make those masks for sick family members. If you have friends or family members who are sick and they need to not cough in the household, those droplets around, try to keep those from spreading. That's really where you can be of great use in making those masks. And then also we're coming up with a list of other places that may be able to use those. Currently, our donations are really focused in on the medical community and what's appropriate for them in this time. And so we are not able to use those home-sewn masks at the time. So please be aware of that, but we do greatly appreciate your concern and your commitment to helping us in this effort. Also, one last little piece of information. We're doing everything we can right now to help make sure that our medical community, our first responders, and those at the hospitals are able to treat patients and don't become patients themselves. There's some specific tactics around that. Obviously, the first is making sure that we ration our PPE and use it appropriately, and also looking for new guidelines on how to stretch those recommendations out. At this time, I will go ahead and take any questions that members of our media might have texted us coming in.
So we have a couple of questions from Kelsey over at KMTR. The first is, with 4J employee testing positive, does this change anything that parents or students should be aware of?
Thank you. The question is, with the 4J employee testing positive, does this change any recommendations for parents who are concerned right now? And the answer to that is no, it does not change our recommendations. Really, what we're looking at the 4J community right now, all 17,000 households who have kids in that school district, is to really follow the general guidelines for the community. There was a group of about 240 people that we reached out to directly. Those are individuals that had, potentially that direct contact with the employee, and thankfully we were able to really narrow that list down and have those one-on-one pieces of communication. And I do think that this question opens up sort of a little bit of an explanation that we can give on folks on how that process works with our investigation. So when we're doing case investigations, we try our best to identify those points at which potentially the public were exposed. If we're not able to make a one-on-one communication, then we do the general announcement, and then hopefully find a way for the public to interact with a CD nurse or with someone who can provide them with better guidance. It was tricky with the 4J case because really what we are receiving from the CDC and our federal partners, those kids didn't meet the threshold for that public notification, but we felt it necessary to inform our public. So really we went ahead and made that information available and started making those contacts just in an abundance of caution, and really understanding that parents are very concerned about their families and their kids and any exposures they might have had. And so that's why we did what we did and made those recommendations. We did see a fallout in terms of some confusion around that, and that was understood right from the get-go that we were going to probably have that. So I think it's important for the community to understand why we acted in the way we did, and why we really didn't give out the specific name of the employee or any additional details. It was because we felt as though we had adequate one-on-one communication. And it's, if you have used social media or seen something on the news, you know that that communication where we do mass media isn't necessarily the most effective way to communicate to folks, that really that one-on-one communication is going to be the best way. And so really that's where we prioritize, is having the one-on-one communication. Not necessarily always for privacy concerns, but really to facilitate the free-flowing information and make specific recommendations to that family and for that child.
The second question from Kelsey was, with an expected stay-at-home order from Governor Brown, how much could this flatten the curve in Lane County?
The question is, with the expected order from Governor Brown, which will really look at staying at home, how are we expecting this to flatten the curve in Lane County? So first off, let me just put the disclaimer in there that really the effectiveness of any public health measure is contingent or dependent on our public's participation. And really, I believe in my heart of hearts that Lane County is a participatory community, that we want to do the right thing and we want to get through this as fast as possible, and staying at home is how that's going to happen. We believe that if we abide by the governor's recommendations and by her order, and we follow those good public health practices like proper respiratory hygiene, like social distancing, and really look at the thought process behind that rather than just the specific recommendations, that we will flatten the curve. And the figures that I heard is if we had 100% participation, this could be in that 14-day time range. And that's obviously, in a perfect scenario, not likely to happen because we need to get information out to all communities, and there's going to be a ramp up. There's going to be a lot of questions. There's going to be a lot of, does this apply to me? Does this apply to them? And so really we're just hoping for that participation and then seeing this work as fast as possible.
Question from Emma Jerome over at KEZI. Does public health believe Kate Brown should issue a stay-at-home order?
The question is, does public health believe that Kate Brown should issue a stay-at-home order? And so I think from Lane County Public Health's perspective, we trust that our partners at the Oregon Health Authority and that the governor and who the governor has sought out for those trusted sources of information and tactics are doing just that. And we are confident that they will make the appropriate recommendations. And then certainly our elected officials here in Lane County have made their concerns known. A letter was published and made public this weekend with our chair, Heather Buck, from the Board of County Commissioners, as well as Mayor Vinnis and Mayor Lundberg, really calling for a statewide order, not only because of the proven public health effectiveness of such an order, but also to avoid confusion and avoid unnecessary travel to areas that might have more lax recommendations. And so I think that the order that, or the recommendations that we've seen come forth from our electeds really speak for themselves.
All right, question from Bob Shaper over at KEZI. Valley River Center is open. Is that a concern?
So the question is, Valley River Center is open. Is that a concern? So we have been privy to a few of the initial drafts of some of the governor's language, and really what it looks down to are what are those essential services. And so within Valley River Center, there are some essential, what would be qualified as essential services in that facility. So obviously access to those essential services needs to be guaranteed. How that plays out after the governor's orders, I can't speculate on, but for right now, it is acceptable that they are open.
Question from Rachel McDonald over at KLCC. She noticed kids playing on a local playground this weekend and has heard from listeners that they are concerned about kids using skate parks. Is there potential for the county or cities to close playgrounds?
So the question is, and I'll try to capture what Rachel from KLCC is trying to get at here. Playgrounds are being used. So obviously outdoor spaces are being encouraged so folks can have that reprieve of being able to go outside, get a breath of fresh air, but that the playgrounds themselves are being used and skate parks. Is there any thought about closing the playgrounds? And so what I will say right now is that we are doubling down on our messaging for folks to really embody what we're trying to do here, which is stay at home as much as you possibly can. If you need to go out, get outside, then get outside close to your home. But be conscious of those hard surfaces and the surfaces that other people are touching and using. That definitely includes playground equipment, and we would encourage people not to use the playground equipment in lieu of any specific direction.
Question from Adam Duvernay over at the Register Guard. How are the county, local hospitals, and primary care doctors coordinating, especially considering the hospitals are asking people to first go to their primary care doctors if their symptoms are not severe?
So thankfully we have a good group of medical providers here in this community who participates every day in our 4 p.m. call. So this is a telephone call where we can have interaction between our health professionals in public health, like Dr. Patrick Ludke, our Chief Health Officer, and other public health professionals, making recommendations and coordinating those services. We also have within our Emergency Operations Center a specific function around coordinating our medical community and trying to make sure that we have a clear message for folks who are seeking medical attention. I think an important point to consider is the fact that as we go through COVID-19 and this outbreak, we're also seeing other medical problems. We still have people who need to be seen for heart attacks, for oncology treatments, and for other things, accidents in the community. And so we have to make sure that some of that work is being done, and that is being done by public health is really the driver of coordinating those services and making sure that we're not overutilizing our ability to respond.
So Jason, it appears based on a heads up from Brian at KZI, who's multitasking right now, that the governor has just issued her executive order. So where can people go later today to find out what that means for Lake County residents?
So I believe we will huddle as a team and try to identify what the best resources are to communicate out the governor's message. That may include an additional briefing, but at this time we'll just be planning on how best to share those resources. I know that we'll make all that information available through our call center. That continues to be a great resource for folks to call 682-1380. Again, we have to catch up on all the specifics. I anticipate the governor's order will be comprehensive and rather long, so we need to get educated as well. Even though we have heads up on it, I think we need to review and then get back to everyone.
I have no further questions coming in from media at this time.
And with that, we will be back as soon as we have updates. Thank you.